Well, hello there, Dr. Brian McKay, Core Health Darien, my podcast, not just a chiropractor for Stanford Darien, Norwalk, New Canaan. Excuse the lengthy title, but I guess it's geotagging in this day and age of trying to find me on the internet. But anyhow, getting warm weather finally. Well, kind of in the Northeast. We got a little bit choppy here and there, little cold weather mixed in with some couple nice days. Well, anyhow, we are today's Cinco de Mayo, so happy Cinco de Mayo days. We're going to talk about tennis elbow, as people are now getting out there and being more active. Hopefully, I'm going to go a couple different points about tennis elbow. First of all, tennis elbow is also known as lateral epicondylitis. Okay, and so when you see like the itis, like it gives the impression of there's inflammation going on. And in all reality, tennis elbow is really a degenerative process of particularly one muscle called the extensor carpi radialis brevis at the elbow. So what happens is that repetitive motion, even just keeps dinging the insertion point of the extensor carpi radialis brevis. Now the extensor carpi radialis longest doesn't seem they're really next to each other, uh, but the brevis is a little bit lower down in the elbow, more closer to the elbow itself, and the longest is a little bit higher. So it seems to, and it goes a lot longer as well. Brevis means short, by the way, in case you didn't take Latin in high school, like some of us did. So it's really not an inflammatory condition. So when people go and get a cortisone shots take out inflammation. Well, you're probably not in the right. You know what I'm saying? You're not treating it properly because the tendon degenerates. Why would you take an anti-inflammatory? Why does Advil not work? Why does Aleve not work? Um, so, since it's degenerative, it's usually a progressive, chronic condition. Now, you may not have pain all the time, but you don't have to have pain to have a chronic condition. Someone going to have a chronic cardiac issue, but doesn't mean they're having a heart attack all constantly. So, hopefully, you get that this idea. It's a degenerative process. It doesn't typically go away on its own. And you know, young people really don't get tennis elbow. And again, let's just use the other name, lateral epicondylitis, not to be confused with medial epicondylitis. And epicondylitis, you're basically just think as your elbow. Medial epicondylitis is golfer's elbow. Topic for another day. Similar, but different side. The outside portion, like if you stand up and you turn your thumbs out to the side, you medial is the one elbow closest, lateral is one furthest away. So lateral epicondylitis, aka tennis elbow, medial epicondylus, aka golfer's elbow. And so usually it's seen, middle age, and it's kind of like rarely seen in the elderly. I think at that point there's enough aches and pains as you get older that you kind of forget the tennis elbow or you stop playing. Um, in some cases it does go away on its own. We don't see it too often because when someone comes in here, typically they're going to be here to get treated. So um, it really doesn't. It's odd, but it can get better on its own. So if it does, great. Save yourself a lot of money, a lot of pain. Now, there's different splints that are out there. There's different sleeves, and I can't keep up with all the different ones. There's one particular one called CHOPAT, CHO-PAT. Got its name from its origination as a treatment for um, chondromalacia patella, which is inflammation. You know, it's a knee issue. Again, topic for another day. So when you have the epicondylitis going on, what happens is you really need to have. You can use a CHOPAT, which takes the force away from the insertion point of the extensor carpi radialis brevis insertion point. So it makes things a little bit easier for you there, I would have to say. Um, Here's the other thing too: is Advil and Aleve. Yeah, you got to do some good with it, but like Advil relieve it for inflammation when you have a degenerative condition. Not really. So, hey, do it. I mean, you can go ahead and strengthen the wrist extensors, and that sometimes works. Sometimes physical therapy does work, but I tend to see that ultrasound stuff like that, muscle stim doesn't really work. Um, and here's the thing: is people go for the steroid injections, but they also have the ability to weaken the tendons. So here you have a chronic, progressive, degenerative condition of the tendon, and the steroids reduce inflammation. And we just got done saying that typically it's not a inflammatory condition; it's a degenerative condition. So, hey, you go in, oh, let's hit it with a shot. I don't know why people continue to do it, but listen, whatever you obviously you listen to your doctors. Sometimes the doctors don't read or do the studies that go on afterwards. So you really don't want to get too many of, say, okay, you want to play, you're dying to play, and you go ahead and do it anyhow. What happens is you're weakening the tendon. So over a period of time, you're going to be doing more damage to that. So that's kind of what the takeaways here is. Um, we started to find that using shockwave therapy can really make a difference because it enhances blood flow. Enhanced blood flow, another term is called angiogenesis. So angiogenesis brings blood to the area and allows for that regenerative process to really start to reverse out. So not only is it a very painless treatment, it's a very effective treatment, a lot quicker. So I would say shockwave therapy, but then again, I use shockwave therapy and I do cortisone injections. So you have to understand my point of view on the thing is, but the other thing is, tennis elbow can be helped. There's a number of different ways to do so. Shockwave therapy, I think, is hands down the best and fastest way to do it. But again, you may want to take the steroid injections. So I'm Dr. Brian McKay, not just a chiropractor, but Stanford Darien New Canaan, and I would welcome any questions. My number is 203 656 3636. 203 656 3636. Have a great day and happy Cinco de Mayo.